Hello and welcome everyone to DRJ's webinar series. I'm Bob Arnold, President here at Disaster Recovery Journal. Today's sponsor is Everbridge, and the topic is an update on the coronavirus. Industry expert Regina Phelps will be offering recommendations for your organization's pandemic planning efforts. Before we get started here today, I want to review a couple housekeeping items. Today's session is being recorded. This recording will be shared with everyone tomorrow via an automated email. Attendees are also in a listen-only mode. If you would like to ask any questions, please use the question panel you'll locate on the right-hand side of your screen. We'll answer as many of these questions as possible at the end of the session. Now back to today's topic on an update on the coronavirus and your pandemic and infectious disease planning efforts. Our presenter today is Regina Phelps with Emergency Management and Safety Solutions. Regina is an internationally recognized expert in the field of crisis management, continuity planning, pandemic infectious disease plans, and exercise design. She is the founder of EMS Solutions, and since 1982, EMS has provided consultation and speaking services to clients in 5 continents. Phelps is a frequent speaker at international continuity conferences and is consistently rated one of the top-rated speakers in her field. She is also the author of 4 books, all available on Amazon. With no further introductions, I'd like to welcome and turn the mic over to Regina.
Great, Bob. Thank you so much for that kind introduction. It's a great pleasure to be with all of you today to talk about the new coronavirus and also to give you an update about what's going on as of 45 minutes ago, and also to ask you to look at the coronavirus through the lens of 2 documents I hope you possess in your organization. The first being a crisis management plan, and the second is infectious disease and pandemic plans. So let's take a look at my agenda. I'd like to first of all talk about the threat as we know it as of today at 10:15 Pacific time. I'm going to then focus my attention on 2 major planning efforts that hopefully are well underway in your organization, your crisis management team and the process it's using right now, and also your infectious disease and pandemic plans. I am very often speaking about those 2 topics, and I often do a 1-day workshop on each one of them individually. So for this webinar, I've had to really cherry pick through my material to think about what I could give you right now that would be the most important information to help you begin to really assess this threat to your organization. And lastly, we'll talk about personal preparedness and the next steps for your organization. Let's begin first of all with where are we now, right now, with the coronavirus? Well, first of all, coronaviruses, as we all know, are upper respiratory and gastrointestinal, are found in the upper respiratory and gastrointestinal system of mammals and birds. Coronaviruses actually cause a vast majority of the common colds that human adults and children suffer with every year. There are actually 7 different kinds of coronaviruses. The first 4 on this particular slide are the ones that do impact us from a perspective of everyday common colds. The last 3 are the ones that we have been following closely since 2002. So first of all, SARS, which started in 2002, and was probably the first disease that really captured the attention of everyone around the world, starting in China, spreading to 37 countries, really impacting our neighbors to the north in Canada, resulted in 774 deaths, over 8,000 cases in those 37 countries. The next coronavirus that really got our attention was the Middle East Respiratory Syndrome, otherwise known as MERS. That started in 2012 and is still circulating today in the Middle East. It has only 449 deaths, but it has a very small number of cases reported in 26 countries. And then lastly is the one we're going to talk about today. If you look at this next slide, what it shows you is those 3 diseases in the order of case count. So you'll look at the top of the slide on the right-hand side, and you'll see that there was just over 8,000 cases of SARS in that 1-year period, with a fatality rate around 9 to 10%. Then if you look down to the one below that, that's where we are today with the new coronavirus. Not yet named, by the way, so it's still going by its official title of 2019 N for novel coronavirus. starting in December till the present day, is almost at 8,000 cases. So it will very quickly, probably by this afternoon, pass the SARS case count. But we only have 170 deaths, which is great. And the fatality rate now is around 2%. Then you look down to the bottom, you'll see MERS. And again, that's the Middle East respiratory syndrome. Look at the case count, 2,494, but look at the death rate, 858. The fatality rate of that disease is 34%. Thankfully, we're not facing that type of situation today. And just for a point of comparison, I wanted to actually cite the CDC estimates for influenza. Of course, flu kills lots of people, around 55,000 every year in the United States. And it results in between 9.3 million and almost 49 million cases every year, between 140 to 960,000 hospitalizations, and between 12 and 79,000 deaths annually. And of course, that really depends on the virulent nature of the flu. And that goes back to 2010. That just gives us a little bit of perspective as we talk about this illness today. So our current threat, as we all know, started in China. It started in Wuhan, China, and there was a pneumonia cluster that started around December 1st. That was the first case that was recognized. And these cases were initially all linked to visitors or workers at the Hunan seafood wholesale market in that location. January 2nd is when we actually got the new strain of coronavirus actually identified, and it was designated the 2019 nCoV. At that time, 2/3 of all of the people that had become ill had a direct exposure to that particular market. Samples from that market's animals were actually taken between a 12-day period, January 1st to January 12th, and at that point, they discovered that 33 of the 585 animal specimens that were examined, 31 of those came from the wildlife area of the market, clearly stating that the real exposure was from those wildlife creatures such as bats, snakes, civets, and so on that are actually held in that market. So what are our current statistics? Well, as of this morning, January 30th, and by that I mean 10 a.m., the case count was 7,921. Our death rate so far is 170. It's now in 22 countries, India being the latest one of today. The incubation period is varied between 2 and 14 days. Initially, when this first came out, and through the month of December and a good part of January, there was a lot of discussion that it was 14 days, period. Now that's shifted, and now the incubation period seems to be ranging between 2 and 14 days. Probably the big news of today, which I'm sure many of you have already heard, is there now is human-to-human transmission that has been confirmed in the United States as of 10:15 this morning. This was in Illinois, and it's the 6th case of the virus in the United States and the first case of human-to-human transmission in the US. Also this morning, I can't imagine what this would be like, there's actually a cruise ship that's actually confined at port near Rome as a couple is being tested for the virus. So there are 6,000 passengers and 1,000 crew members all looking at each other, I'm sure with very suspicious eyes as they wander about this cruise ship, waiting for the test results to come back about these two individuals. So I guess there's worse places that we could be this morning. My focus this morning, as I mentioned, is going to be on planning for an impact to your employees and your organization, really through the lens of two things: crisis management and infectious disease and pandemic planning. I'm going to start with crisis management. And again, I could talk for days about this particular topic, and I've done so, and I've written, my newest book is on crisis management. I'm going to focus on two areas that I think are incredibly important for you right now. And hopefully you've already done all the things that I'm going to mention. If not, you need to, as they say, get on it. And I'm going to first talk about situational awareness and the kind of situational awareness that you need in order to manage this potential health crisis. First of all, let me start with the definition of what situational awareness is. Situational awareness is the ability for you to identify, process, and comprehend the critical pieces of information regarding any incident. So essentially, it's really just knowing what's going on around you. But that sounds easy, and it's actually not often easy. You need to really focus on two skills in order to do this well. You need to, first of all, collect information. You need to observe information, acquire it, compile it, and verify it. And I'll talk about that in just a moment. And then once you have that situational awareness in your hands, then you have to assess it, orient yourself to the possible impacts, and then you need to disseminate that information. So let's first of all talk about collecting situational awareness. And I want to there's two sources that you'll be looking at. One is internal sources, and the second is external sources. Let's talk first of all about internal sources. How do you gather situational awareness? Now, what I want you to think about is, first of all, where do you need to gather this information? So, for example, if you're in the United States, you could certainly monitor your employee illness, but for the most part, all of us in the US, except for the 6 locations where there are victims, have had no cases. We have no local health impact locally. So I'm asking you to think about every location that you occupy throughout the world, every location in the United States. And what kind of information do you need from them in order to be able to assess and plan appropriately? We generally look at 5 major categories that we would ask questions about. What about your people? What about the facilities? Impacts to technology, impacts to business operations, and lastly, reputation and brand. We've been asking our clients today to actually design a process where they can go out and ask specific questions about these 5 areas in high impact areas. So for most of our clients, that's been primarily in China, but also in Asia, Thailand, and others where they are increasing their case count. And let me give you an example of the kind of questions you might want to be sending out to these locations. The first one is in the area of life safety, really talking about people issues. And the first thing I would ask you to consider and ask questions about to those local sites you're going to send this to is what's happening in your area or region. You know, give us a picture on the ground. What's the case count look like? Are there a lot of people that are sick in your area? Is everybody wearing a mask? What's happening with reporting, both public reporting and social media? I'll talk about social media in particular in just a bit. Is there any changes or conversation about government restrictions or guidance that you need to consider? Many governments are now beginning to discuss such things as quarantining or doing other kind of social restricting. Is there any of that going on? And then lastly, and very importantly, what's your current employee illness today? And compare that to the usual time for last year, a usual time of the year. So if all of a sudden you're beginning to see an uptick of one person more than usual, 5 people more than usual that are sick, 10 people more than usual that are sick, you need to be on that and paying attention carefully. So from a life safety perspective, ask yourself, what do you need to know, want to know about your key locations, and from a people perspective, and be able to codify that in a few short, easy questions. Secondly, what about your facilities? Are there any issues for you to consider related facilities? And right now, most people are really concerned about a couple of key things. Do they have, for example, sufficient masks or gloves? Do you have hand sanitizers? Do you have wipes that you can use to clean surfaces? There is a global, no surprise, shortage of masks. I have clients that cannot get masks at all, and some of these are actually healthcare facilities. So this is becoming a huge issue, especially for those that use them on a daily basis as part of their work. So if you don't have masks or gloves or much hand sanitizer, you're going to be really struggling to find those in many of these key areas. Are there any other facility concerns that you might have that you would want to be surveying or asking at this point? And again, that's depending on what's held at those locations. Thirdly, what about technology? If indeed the situation in any of your locations becomes really a problem, do you, for example, have sufficient bandwidth in order to be able to have a large work from home solution? Many folks have not tested that. Many don't know exactly what their work from home capacity would be. And I would encourage you, this is a great time to really dig deep on that and see if you actually can answer that question. It's also a very good time to be looking and paying attention to an increase in cyber attacks. And we all know that cyber criminals and the bad guys in general who do hacking will look for opportune moments where everyone's preoccupied chasing some other issue, and it's a great time to increase ransomware, phishing attacks, and other types of issues in order to penetrate your network. Are there any other technology issues you might have or be concerned about? that you would want to think about? Do you have a backlog of laptops you could disperse to people to work from home who may not have those? Thinking about it from that kind of perspective. The last two areas, business operations. Is there any impact on your production? Do you have any impact on what you do for a living at that location? Some of our clients are starting to experience actual production problems tied to supply chain disruptions already. So I would ask you to be thinking about, do you forecast in the short term supply chain related issues? Look at all the items, for example, from your vendors. Where do they come from? If they're coming from China in particular, that could present a real significant and serious problem to you over time. What about quality issues? Are you having maybe less staff or people that aren't coming to work, and so you might have issues related to quality? Really peel that back and see what you might need to do to tighten that up so you don't end up having a quality problem later on. Are you starting to get queries or concerns from your customers who might be concerned about your ability to meet your service level agreements? Think about those things. Really work with your key business units, determine what some key markers are, and then track those over time. And then lastly, reputation and brand. Is your organization in the news at that location? Are they getting news inquiries as to what you're doing in order to be able to plan for this possible global health emergency? Could the organization in your location be part of a news story, meaning that all of a sudden there's something that begins to happen where you start to become the news story? Maybe you have somebody that becomes ill and they actually test positive, and then all of a sudden you're seeing your organization written about in local coverage that may even be picked up internationally. Do you have your holding statements at the ready so that if there is queries from reporters, you can be on it immediately and not flat-footed, and that you're able to respond appropriately? I would hope now that your corporate headquarters has already developed all the key holding statements for all of your major stakeholders, starting with your employees, which I hope you're communicating with now, all the way up through investor relations, but certainly key customers, vendors, investors, others. And then lastly, depending on what you do for a living, you also might want to consider if you have a crisis communications team on retainer. Are they available? What's happening with them? Check in with them so that you can be up to date immediately if this begins to be a more serious issue. These are a sample set of questions that what I would really ask you to do is to take this idea of actually communicating with all of your key locations, especially those in impacted sites, impacted areas around the world. What are the key things you want to know from them? And then develop those questions and send them out to the appropriate people. Once you begin to refine that, and especially if the situation continues to worsen, ideally this situational awareness would be something that you would send out on a daily basis and would be sent back to you from these locations around the world. Then what you can do with that situational awareness that you're getting from every one of your key sites is to be able to compress that, organize it in a way, which I'll talk about in a minute, of which now you can use to send out to your crisis management team, to your executive team, to keep everybody informed. This will help to minimize how many times people are contacted or called, and it will stop them from having to say the same thing over and over and over again to a million different people. Try to be efficient in your ways of utilizing these folks. Also, you need to collect situational awareness from external sources as well. And the first thing you need to do is you need to have some really good, credible health sources. Ideally, what you've got already, of course, is the WHO website locally bookmarked for you, and also the CDC. If you're outside of the US or you have organizations outside of the US, you want to be monitoring the National Health Agency for those countries, but also local health departments here in the US, wherever you're located, as well as any across the world that you are at. Other things you might want to consider as far as local situational awareness is if you have a relationship with an infectious disease physician. Now, some communities don't have a lot of ID docs in their area, but many that are near teaching hospitals in particular will be able to find physicians who have specialty in infectious disease who could consult your company if need be. And it's nice to know kind of now who you might call or reach out to if indeed this problem becomes really significant for you. Here in the Bay Area, there are two places that you could go to, Stanford or UCSF, but across the United States, there are many teaching hospitals, many medical schools, many that do have infectious disease programs. So this is a good time to find one. Oops. The next one is the external sources. So what are your credible, solid outside news sources? Right now, there's about 5 organizations that are really doing stellar reporting in the United States, one in the UK as well, that actually I go to on a regular basis. The New York Times and the Washington Post and Bloomberg News and The Guardian all have a live update section on their website with validated information that is very timely and super important for you to be aware of. NPR, also National Public Radio, has been doing the same thing as well. Develop your credible list of outside news sources. So you need health experts on one side, we need news sources on the other. If you are going to use social media at all, you need to triple, double check every social media post you have any idea that you might source or discuss. And that's because already there is unbelievable amounts of conspiracy theories already that are online. One of my current favorites is this one. I thought I would just share it with you because it's so ludicrous, but my gosh, this guy has a lot of followers. There's a site called Prepare for Change. This was the posting on 24 January. And the whole query of this post is about asking the question if you know how the virus has jumped from China to the US in no time at all. Of course, I look at that and think about, well, haven't you heard of planes? But anyway, this guy has the theory that the virus did not originate in China, but it's actually deployed by the CIA, and it's being going to be introduced all over the United States in order to bankrupt us. It's also going to require us to have all free vaccinations so that the government can control you in some way. So anyway, he has a 72-page document related to this, and there are people that follow that. So please be aware of anything you find online. Once you've actually collected the information from your internal and your external sources, the next thing that you need to do is you need to actually develop what's called a situation status report. It's also known as a SITREP. Now this document, and I'll give you a sample of what it could look like, should be disseminated on a daily basis to your crisis management team and your executive team. And let me just make sure that we're using the same terminology, because in our field, we often use different terms to describe many things. When I speak about a crisis management team, I'm talking about the tactical team that's on the ground managing the event. The executive team, which sometimes people might call a crisis management team as well, are the ones that are dealing with the strategic issues about this situation. And by the way, they should actually begin to be thinking about strategic issues. And let me give you an example of this. If you actually produce a product, and let's say that at some point in this discovery, you realize that you're going to actually be unable to fulfill all of your orders. A significant strategic decision might be from your executive team, well, if you can't fill all of the orders, which customers would actually get them? That's a pretty big, chewy thing to think about. And that could happen to you. Once you also have got the SITREP report, now you can actually develop the action plan, the incident action plan, using this SITREP document. And what the incident action plan is where you're developing key objectives about what you're going to do in order to manage these issues. And if you're organized in the incident command system, as most of the crisis management teams we develop, you're actually utilizing these objectives by the actual individual teams within the crisis management team with very clear assignments. And then I would consider you to really have a pretty well-organized format. And I want to give you an example that actually the WHO just came out with 2 days ago. And this is, if you go to the WHO website and you look for situation reports, what you're going to find is now they have a really slick looking document. I just took a screenshot of the first half of this page, just so you could see really close up what it looks like. The SITREP report that the WHO used to actually produce was really hard to read. It was hard to find out information, but now they have brought it really forward. And think about this going to an executive. They would be able to quickly see what the big ticket issues were on the left and what the situation was as far as numbers on the right. So when you look at that, I would really encourage all of you to go to that particular page and actually take a moment to really look at it and think about how you're developing your SITREP report so that it looks engaging, it's a quick read, and also they can quickly get their brains wrapped around it, and you're providing value instead of having them slog through a lot of information. While we're on the topic of the World Health Organization, I just want to talk briefly about the meeting that they're having today. So as you probably all well know, the WHO is having their second or third emergency meeting this week related to this particular outbreak. They're trying to decide today whether they will enact the Public Health Emergency of International Concern designation. Let me just talk for a moment about that. So the Public Health Emergency of International Concern was actually created post-SARS, so that was in 2005. And to meet the criteria for the WHO to basically designate this public emergency designation, the requirements must be that there's a significant public health risk to its member states, either through the spread of an international disease and that it actually requires coordinated efforts. And you could probably argue that we're probably getting close to that, but we'll see. There's only been 5 designations of that since it was enacted in 2005. The 2009 swine flu, of course, we all remember that, the H1N1. The 2014 polio declaration, which is still in effect, by the way, today. That's in Pakistan, Cameroon, and Syria. The 2014 Ebola, which was in Western Africa, that's now been off. 2016, the Zika virus declaration. And the 2018 to this present day Ebola outbreak in the Democratic Republic of Congo. So today, the WHO will make an announcement as to whether they are enacting the Public Health Emergency of International Concern designation. But there are no mandates that happens. What it does do is it starts a lot of more international coordination, but it has no teeth, if you will, to actually really make a country do something. So just keep that in mind when you hear it today. Let's talk about another aspect of crisis management, which is incident assessment. And hopefully you've already done all of this and you can just sit back and pat yourself on the back. What you have to have in place when you have a good crisis management process is you have to have a very clear incident assessment process. And what I'd ask all of you right now is it clearly documented in your crisis management plan, who comes together in your company right now to assess an ongoing situation, whether it's this virus or frankly anything else that could be happening to you. And who has the authority and the responsibility to make the decision to activate the plans? And what is the criteria that they're using to do that? Is it documented and do you practice it? And I will tell you after 38 years of practice that I rarely find this well documented, if at all, in most crisis management programs that we actually audit. And I would really beg you to add this. And if you haven't met and you have one, you need to do that today. This incident assessment team, first of all, if you don't have this or you want to validate who's on your team, first of all, you want to determine who should be on the team. Right now for this outbreak, I should tell you that the people that you want to have coming together to make this assessment and the decision if you're going to activate anything would be business continuity, facilities, security, EH&S, that's employee health and safety, human resources, communication, and technology. What they need to do is conduct the initial assessment, which of course means they need situational awareness, which is why I wanted to start with that earlier. They have to know what's going on, otherwise they don't have the ability to make an assessment. Then ideally you've got criteria that they can assess and they can actually then make the decision about plan activation. And then lastly, you should have very clear guidelines on how they communicate both physically and virtually and determine how they're going to learn of the incident. So are you deploying your emergency notification system like Everbridge, for example? When this team comes together, and ideally you've already done this, but if you have not done this for this outbreak, you need to do it today. You need to, first of all, make sure you've got appropriate situational awareness. You need to then actually share that situational awareness with the team and then contrast that with your activation criteria. And then what you need to do is you need to ask the question, should we activate our team and our process? I will tell you right now that every one of the people that we're working with closely right now, about 100 companies, have all stood up their incident assessment teams. They've all done a partial crisis management team activation, and they are doing daily check-ins, generally by phone, that may last around 30 minutes. There's a lot going on, and there's a lot of things that you need to make sure that you're monitoring. If you say, no, we're not going to monitor this and we're not going to activate it, I don't recommend you do that, then you would stand down this team. My last crisis management thing I want you to think about today is this, is that you need to be managing the situation that's in front of you, but you also need to be looking forward. What do I mean by that? I would pray that you are not flat-footed. I would encourage you strongly to spin up a longer-term planning team that's going to be looking at the weeks and months into the future to really understand what the heck is going on with your company. Things like supply chain disruption. Are you going to be impacting customers? What if you actually have a decrease in employees who can come to work? You need to think about the long-term implications, not just today and tomorrow, but in the weeks and the months ahead. So I would really ask you to seriously stand up a longer-term planning group who's going to be looking at this with new eyes every day. There's another term you might want to consider, and that's actually standing up what's called a Plan B team. This requires a strong leader to be able to do this, I'll tell you. This actually idea was really birthed in the CDC during the 2009 global pandemic. And what they did is they asked a group of really smart and bright professionals at the CDC to basically spin off into a very small team, and their entire job was to look at the crisis management team actions and decisions and constantly keep asking the question, what else should we be doing? Are we going in the right direction? And are we truly managing this crisis the best way possible? There's a tendency for leaders in a crisis to have what's called cognitive bias. And often what that means, one of the forms of cognitive bias is that we fall in love with our own ideas. And we forget that we need to be thinking about a variety of options. And sometimes what you need is you need somebody to call that out for you. So a Plan B small team does that. But it does require a brave leader to do that, because people might really critique what you're doing and you may not like it, but it can really pay off. Okay, so let's talk about the second part of my presentation, which is really infectious disease. And as I mentioned, I could talk literally for days about this. So I've cherry picked again through what I think you need to have. Now, many of us on the call probably went through the 2009 pandemic. And let me just say a couple of things. My background's originally in nursing, and I got very interested in global pandemics. When I attended a speech, I was giving a speech, and I went to one of the speeches at that same conference in Toronto called the World Conference on Disaster Management. And the keynote speaker that morning was the woman, a physician who was in charge of the whole program for pandemic planning for the nation of Canada. I had never heard of pandemic planning, which is kind of amazing, being a nurse, but I did not know anything about it. So I came back to the United States, and my firm researched what was available in the United States, and there was really nothing except what the CDC had done for the 1968 H3N2 pandemic. So way back then, we started researching what would a company do if there was a pandemic, and how would we go about that? So we started writing pandemic plans only in 2000, and we wrote lots and hundreds of them before the pandemic in 2009. When that pandemic occurred, as we all know, it wasn't very deadly. And we made a huge strategic error, as it turned out most people did, as we tied all of the triggers of our plans to the actual WHO levels. And those are the actual progressions of the disease marching around the globe. And what happened is that when you pulled out those plans in the 2009 pandemic, they weren't terribly helpful because they were tied to the WHO levels. So that made us completely rethink everything. And we decided that we would, first of all, strip away plans from being tied to the WHO levels. And secondarily, what we would do is that we would make them about infectious diseases and a global pandemic. So one plan that could do both. So we're calling this essentially kind of Pandemic Plan 2.0. And again, the pandemic of 2009 really showed that we had levels tied to the wrong criteria, and we wrote it only for a global pandemic. So if you had a local outbreak of measles in your call center, it wasn't super helpful right away. You had to really try and make it work. So because of that, we've changed everything that we do when we write these plans, and I would encourage you to do the same thing. So all of the plans that we write now are called infectious disease and pandemic plans, and they have broad guidance, and I would encourage you to have them be able to accommodate a common illness like measles or whooping cough or other types of diseases that are very common now in the United States because of decreased vaccination rates. So also, you're going to have a lot more likelihood of having that happen to you than this global illness. You also want to make sure that the plan that you write or revise has got broad knowledge and broad information. It's not disease specific. And I wouldn't encourage you to have clear guidelines for a particular disease because it's going to change. And when you pull it out and look at it when an outbreak occurs, it may not be accurate. So it's better to have broad guidance. And also medical treatments can also change as well. And I also want to remind you a key thing is that you do not control your destiny. If you have an outbreak of a serious illness in your facility, the people that control your destiny and are the controlling authority is your local Department of Public Health. So they can evoke public health law, which means they can do just about anything that they need to in order to preserve public health. So they control your response in many ways, and they can issue orders to you, instructions and dictates based on the illness. So they really become your owner, if you will, for the purpose of public health, which is important. So you want to be thinking about this when you write your plans. Even today, as we're looking at this global issue, they should be written that diseases are local. And when I think about that, so we're experiencing this global health issue right now, but many of you have no health effects at all locally, unless you're having some major flu issues, but that's a totally different thing. So does that mean you do nothing because we have this impact that's happening someplace else, but nothing's going on in your area? No, you should not be flat-footed. You should actually be asking questions like, do we have things like hand sanitizers? Should we be educating our employees on hand washing and cough techniques? Should we actually deploy hand sanitizers throughout the building? Have we got enough masks on site? You should be thinking about these things, and I'll talk about that in more detail in just a minute. And also, from the business side of the house, which we just talked about, is that some people are having huge impacts already on supply chain. And if you haven't tried to buy a pair of gloves or masks in the last 72 hours, oh my gosh, it's super hard. It's super hard. And so you're having supply chain issues even in that modest situation right there. When we write infectious disease and pandemic plans, we basically have 4 operating planning assumptions. The first thing is that these outbreaks that occur would be managed using your routine crisis management process. You're not going to create a new process to manage this event. You're going to utilize what you already have. The second is you're going to take advice and counsel from the local Department of Public Health and other medical professionals that will be available. And remember that also the DPH is really in charge of what happens to you and the decisions that you make. The third assumption that we have is that you'll be able to do a usual emergency response as normal. And if you have emergency response teams, they would function as long as it was safe for them to do so. So for example, if you have teams on site that go to first aid emergencies, they would still be doing that until it was not safe for them to do that. And then lastly, that your facility would be open as long as it was safe to do so. So those are our overall planning assumptions that we use when we write an infectious disease and pandemic plan. And the kind of scenarios that we look for is something like this. It's possible that you could have a localized disease outbreak that has it's just about you. It's not going to rise to the level of pandemic, but it could be severe and catastrophic. So for example, in our client population, we have had measles in call centers. We have had norovirus in a corporate headquarters. You have that, and all of a sudden you have to close down those facilities for the period of time designated to you by the Department of Public Health. You have to do extensive cleaning. You've activated all your business continuity plans, but this disease is only impacting you. But you still need to respond from that perspective. So it's not that your assessment is such a fine science, if you will, when you look at an infectious disease. It's really good judgment along with consultation with the right medical professionals, and that's really going to be the Department of Public Health. And frankly, a good dose of common sense, which sometimes in disease outbreaks is a little lacking. When we write a plan, we write it with essentially 3 stages in mind. And I would ask that when you pull out your plan, if you have one, that you look at this. The first section is really all of the pre-outbreak preparation and planning. That means there's no risk. So if you were to pull out your plan right now, hopefully you've already checked every box in the pre-outbreak preparation and planning for where we are right now. That could be things like already having talking points, for example, in communications, and it could also be making sure that you have adequate supplies or that you have employee education materials all designated and developed. All you have to do is open them up and print them. Those types of things. Those are all pre-planning that you would have right now for any disease outbreak. The second one is threat assessment, which we just talked about at some length. Threat assessment, extremely important because that's going to kick off the third aspect of your infectious disease and pandemic plan, which is plan activation. And in that plan activation section, you should basically see issues related to impact. And we categorize those in 4 basic colors. So yellow, meaning there's minimal human transmission in your area. Yes, there's minimal human transmission in a variety of places around the world, but I'm talking about your area. The next one would be orange, moderate human transmission in your area. Red, severe transmission, and gray, uncontrolled or uncontrollable human transmission. And as you might imagine, every one of those 4 stages, the requirements and what you're doing becomes more onerous. So by the time you get down to red or gray, you're probably not fully occupied at work, and you have lots of issues to deal with. Taking those categories, as I just described to you, the pre-outbreak planning, preparation and planning, and then all of the activation issues, you need to look at the major departments that need guidance. These are the 12 departments that we most commonly include in our plans. So business continuity, which would also include crisis, business continuity in general, business units, all your key mission critical business units, communications, crisis management, environmental health and safety. If you don't have environmental health and safety as an entity in your organization, who would be dealing with health and safety issues? It could be facilities, it could be human resources. There might be things that would be split between the 2 of them. Facilities, finance and purchasing, human resources, information technology. Mailroom and shipping is there because if you end up having to have people work remotely, you might have issues related to critical mail that might be coming in, or other things that need to be shipped out, like laptops or other things to employees who might be working from home. That's why they are included. Security, because you're still going to have to keep your building secure whether you're there or not, of course, and then travel. What I want to do is I want to just give you some examples about what these might look like. So using the business unit as an example and looking at the pre-outbreak preparation, so things that you've already done, hopefully, at this point. One might be reviewing, they should annually be reviewing the infectious disease and pandemic plan at the business unit level to make sure that it works for them. They, of course, want to make sure that their business continuity plans are current and accurate, and I would pray that all of you have been looking at that. Also updating your employee contact information, as well as what information is in your emergency notification system. That should be happening right now. You want to be organizing your staff into categorization levels, and I'll talk about that more in just a minute. And then you want to make sure that the categories for the strategies for category 1, those are people that must go to work and they are mission critical, that they actually can do that in a safe manner, which means you've thought about things like social distancing. You've thought about making sure you have the adequate supplies for people to actually be able to be at work and be safe. So that's a sample of what I would expect to have already been thought out to this day. It's in your plans for a business unit. Another example of now that we've progressed to minimal transmission in your area, that you would review the employee categorization to make sure that it's right, that you would determine if there was any exposure through critical vendors, if vendors coming on site, vendors you're working with, making sure they have a infectious disease plan and that you want to look at their strategies. You want to assess requirements for mission critical staff to work from home as necessary. You want to make sure you've got the right contractual issues in place for discovering exposures. And you want to make sure that you've got travel insurance issues as included as well. So that's an example of what you might be thinking about from a minimal human transmission in your area at the business unit level. So let's talk about employee categorization. This is a really important one. I will spend just a few moments talking about this. This, frankly, should be done routinely for all business continuity plans. It's actually helpful in a pandemic or a global or a health emergency, but it's super helpful in any kind of crisis that your organization might be facing. We've been asking our clients to categorize their staff since about the year 2000. And essentially, we ask that you look at your staff and drop them into 4 categories. Let me explain each one of them. So first of all, we would ask that you look at each one of your employees and determine, are they mission critical? Do they perform mission critical time sensitive processes that can only be done at work? It can't be done any other location. So in some cases, traders, for example, if you need a Bloomberg terminal, they're going to have to be at some company location. Security officers can't do their job remotely. Some technology professionals have to be at work. Laboratory professionals, if you run a medical lab, have to be at work. So who is mission critical, time sensitive, must be at the site. You need to know that because that's going to involve understanding what kind of planning you need in order to keep your site open. That includes, security professionals, cleaning schedules, all of that stuff. And if you find you only have a handful of people that are category 1, that gives you a whole another picture in your mind of what it takes to keep your facility functional in the moment of a health crisis, or for that matter, any other type of crisis where you have limited ability to come to work. Think of floods, earthquakes, hurricanes, all of that. Category 2 people are those people that perform mission critical time sensitive functions, but they can do them remotely. So this is super helpful because this tells you how many laptops you might need. What about your VPN capacity and work from home abilities, and how broad your network is to be able to allow all of those people to enter in. Do they have the equipment they need to be able to work at home? If somebody needs to scan something every day and they have to work at home for 3 weeks, then that's not going to work unless they have a scanner. So those are things that you need to clearly understand. Category 3 are people that really don't fit in category 1 or 2 categories, but they could actually backfill if need be. And so that's helpful because it just gives you another bucket to put people in that didn't fit into 1 or 2. And they actually might be backfilling and supporting the recovery at those 1 and 2 levels. And then lastly is category 4. These people are not mission critical and they cannot work remotely. And there's probably a small handful of people that are in that category. Sometimes I think of things like receptionists and other individuals who have to be at work, but they may not be considered mission critical at this point. It just gives you a clear idea. So one of the things I would have you think about is think about your employees right now, think about these categories as I mentioned, and think about how you can actually drop your folks into these different categories. Then what I would suggest that you do is that you actually develop a mechanism both in your business continuity plans to do this, about showing the categorizations, but also in your HR database. So whether you use Salesforce or PeopleSoft or any of the other relational databases for human resources, you can actually build a category that has the categorization number. And then you can drop that in, and then you can sort it really rapidly. So the facilities people can see, gosh, I've got 75 people that are category 1. That means I have to accommodate these individuals. Or I have 3,000 people that are category 2 that have to work remotely. Do we have enough capacity with our VPN? So all of those things can be super helpful for you in order to do planning, not just for an infectious disease or pandemic, but also for any type of business interruption. Then the last part of the plan that I would hope to see when I looked at your plan is I would want to see some appendices that covered some basic issues. What are your human resources, both employee education? Hopefully you've got some clear ideas about how you're going to be educating your employees and what the resources might be for that. Hopefully you're doing that right now. How are you going to be monitoring your illness? Many times people don't call into one spot. And so how do you know right now if you've got an uptick in illness? Really important to figure that out. So how are you monitoring illness? What about compensation and benefits? One of my biggest struggles with HR departments is to make them come up with the strategies of how long you would pay people. Would you pay them if they run out of PTO? What about their comp and benefit from the perspective of a long-term outage? What are you going to do? I encourage people to develop those now. You can always change them when the situation occurs, but looking at a white piece of paper to have to develop all of these important strategic policies is very humbling when the crisis is right in front of you. Under your incident management team or your crisis management team, what about continuity of leadership? Do you have succession plans that work? Do you have enough people, and how deep are they? Can you run everything virtually? Ideally, you have some sort of collaborative tool that you're using that you can actually manage this virtually with a crisis management perspective. What are you doing about maintenance and cleaning? What about cleaning, and what about supplies, and what kind of solutions might you use? And all of that would be good to have some guidance there and working with the people that actually clean your facilities. How could you actually establish an isolation facility if you had to, if somebody gets suddenly very sick at work? Where are you going to put them until they are taken off? What about respiratory hygiene? Policies such as dispersing and not having meetings in your organization. That's the best policy to have, dispersing, no meetings at all, right? But you don't want people breathing all over each other in a conference room if indeed we're in the middle of a health emergency. Things like even handshaking. When I work down in South America, everybody kisses each other on both cheeks. I mean, are you going to let that happen when in the middle of a global health emergency? I hope not. So some general hygiene issues and policies are important. And then what about your visitors? Do you continue to keep your building open as the situation worsens? Do you allow visitors to attend? What do you do about people who are supposed to take care of folks from an ERT, that's emergency response team perspective, as far as their if somebody's sick at work suddenly, are they going to attend to them? Are you going to wait for 911? What if 911 doesn't come in a really severe outbreak? And then lastly, travel policies. Last week, we sent out an email to all of our clients saying, please, 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 please stop travel to China. And then the CDC agreed with us on Monday, and that occurred. But you need to really look at travel, and you need to think about where people are going. And if they, I hope none of you are sending people to China. If you are sending people to China or they are coming back, you better have a plan for them to have 14 days of work from home, so that they can actually then go through an entire incubation period, the longest one of 14 days, to make sure that they're not going to potentially infect others. And frankly, coworkers are not going to want to be sitting next to somebody that just got back from China, because they're going to be scared to death. And that could impact your productivity from a whole different perspective. So think about travel policies, and think about even things also related to if people can't work from home for some reason, would you still pay them? And I hope the answer would be yes. It's not worth them coming to work. And people might fib, if you will, if they think they're not going to get paid. All important things to consider. So you might be saying to yourself, where do I begin now? Okay, you've given me all these things to think about, and I've just really scratched the surface here, to be honest with you. So where do you start? Let me give you some things to think about here. First of all, I would start with the most important part, which is yourself personally, and your family. These are all common sense things, but they're super important. Okay, wash your hands a lot, and I mean a lot. I wash my hands a lot during the day, and I'm probably becoming even more cognizant of that. It's so important. And again, that's how diseases are spread, through hands. This disease is spread by two ways: respiratory droplets. So someone sneezes or cough or talks, and you walk through this cloud of things you can't see, you suck it into your lungs, you get sick. And the other way people get sick are from fomites. Fomites are any surface. The virus could live on the surface for several days. You actually touch the doorknob, and then you scratch your nose, and then next thing you know, you're going to get sick. So avoid, first of all, touching your hands. I mean, touching your eyes and your face, please, which by the way is really hard to do. I think studies have shown that most people touch their face about 16 times an hour. It's really hard not to. But yes, to stop leaning on your face with your hand, and stop, rubbing your eyes and doing all of those things. Be aware of it. Avoid being around anybody who's sick. I do that anyway, but I've doubled down on that lately. Use hand sanitizer when you're in a public place and you don't have any access to hand washing. I would wear a mask if I was around people that were sick. It gives you some protection, not a lot, but some. But you probably, if you don't have them, you're not going to find them at this point. And if you find yourself on a plane, which I fly about 200,000 miles a year, if I'm around any coughing person, I have a mask on immediately. Studies have shown that if you are within 2 rows of somebody who's ill, your chances of getting ill are really good. And I would just ask you to be smart and not to panic. We don't panic about the flu every year, and it kills on an average of 55,000 people in the United States. So don't panic about this, but be smart. Think about these things on slide 41. Have a conversation with your family over dinner tonight. All of these things. And just again, raise your awareness and be smart. From a perspective of your organization, I would ask you to go back and look at your crisis management plan and look at the processes I've talked about with you today. If you have a pandemic plan, pull it out, rethink it, massage it right now. If you don't have one, start writing or hire somebody to do it, but do it. You can't be flat-footed about this. And lastly, I would really ask you to take this threat seriously. This is a huge opportunity for people in the business continuity world to show value every day about what you do. By providing a well-written situation status report on a daily basis to the key leadership and crisis management team members, you are showing value every day. You are making sure that you've got plans in place that are going to help this company that you work for survive. That's really what we're all about. So I really ask you to think about this seriously, because you are going to be in a position to provide great value to your business. You do every day already. You're just going to double down on that now. And then lastly, I would really ask you to think about this. You have to be prepared for the long haul. Okay, this has been going on since December 1st. It became an issue on January 2nd. It's now January 30th. We're now getting cases rolling out across the United States, human transmission in the US. This could be a long haul. So don't burn the candle on on all ends, and don't stay up all night and get other people to help you, and be aware that you have to pace yourself. This could go on for weeks or months. So be aware of staff fatigue. That includes your own. Start thinking about staffing charts and get ready for the long haul, because this is going to be potentially months of us having these conversations. And then lastly, this I think is hysterical, but it's really true. The day after this was really announced, about a week ago, Netflix came out with an entire series. They must have had this in their back pocket and just dropped it on all of us. But there is a pandemic series right now on Netflix that was announced last Wednesday. I think that's so funny. But anyway, if you are having trouble sleeping, you might want to watch that. And then lastly, I don't pitch my books very often, but I will tell you I have a crisis management team book that talks about everything I talked about, plus a zillion other things. It's on Amazon, and if you don't have a good crisis management process, I would just draw that to your attention. It would save you a lot of time and Googling. So on that note, I'm going to hand it back to Bob, and Bob, you can take it away, and let's see if there's time for questions.
All right, wonderful. We got about 4 or 5 minutes here for a few questions here. We've got several already. First question here. What suggestions would you have regarding a double jeopardy? For example, if there was a cyber attack and a virus response at the same time.
Oh my God, I have a client who's having that right now. So it's basically what you're doing is you're prioritizing your actions. So you're going to have a group of individuals who are really going to be working on the human-related issues, which would probably be facilities, security, EH&S, HR, all of those sort of things. They're going to be really working on those. Your information security folks and your IT professionals are going to be really dealing on the cyber event. What it means, though, however, is that the leadership of the crisis management team and the leadership of your executive teams are going to be really overwhelmed. So they're going to have to probably think about from a leadership perspective. They might actually come up with 2 different leaders for those processes, both at the executive level and at the crisis management team level, because a major cyber attack is a huge event as well as an infectious disease outbreak. So that's probably what I would do, is I would split the leadership of the team.
All right. How do public health authorities compare across nations and regions of the world?
Oh my gosh, that's a great question, and they vary a lot. And I will say to you that they all have the best intentions in mind, but not all of them are well funded. So, for example, there are several cases now reported in Kenya and Ethiopia. The thing about Africa, they are so underfunded and so understaffed. It's not that they're not bright or smart people, they just don't have the resources. And so for some countries, they are really going to struggle. And what that means, however, is that there might be an opportunity for cases to expand because they don't have the resources to be able to do the epidemiology and really track these things. So that's a concern in the more developed nations.
All right. Does your crisis management book contain guidance on expanding the pandemic plan to a communicable disease plan?
It does not. Thank you. That's a great question. That could be the 5th book I write, but no, it doesn't. It doesn't talk about that at all.
All right. And with almost 2 months into the outbreak, isn't it too early to say 2% fatality rate?
Well, that's based on what's happening right now. So, of course, it could change. And frankly, there's a lot of belief it's going to go down. There was a study that just came out yesterday that talked about the fact that the Chinese currently are primarily reporting serious illness. And so that means that there's probably a lot of people walking around on the ground that have maybe a severe cold, what they think is a severe cold, but they're not getting counted in the case count. If you actually were doing an accurate count of cases, very likely what would happen is that fatality rate would drop even lower.
All right, one final question here. If employers have staff stranded in China, other countries are flying citizens out. How do we address this issue?
That's a really great question. So first of all, I would hope that you actually have some sort of travel provider. And the one that comes to mind is International SOS, but there's probably many others that you might be utilizing. You might need to get some intermediary to help you solve that problem. There's been a lot of effort and pressure placed on the U.S. State Department to try and get citizens out. And there was some that did get out when the 220 or something were flown from China to Alaska yesterday and then to Riverside, California last night. But they don't have a lot of resources to do that. So if people are stranded, you're going to have to find providers that will do that. And it's probably going to cost you some money because most of the commercial carriers are no longer servicing China.
All right. There's several questions we didn't get to here today. We will follow up with everyone after the webinar is ended here. And so any parting words here, Regina?
My slides will be available. So DRJ will have those by tomorrow. And they'll be available for all the attendees today.
Oh, wonderful. I didn't know that. So again, we will share that link with the recording. So thanks again, everyone, for your attendance here today. We hope you gather some great information from today's webinar. If you would like to hear more of these types of sessions and other topics, we hope you can join us at either our DRJ Spring or Fall shows this year. DRJ would also like to thank Regina and EMSS for her time here today, as well as Everbridge for sponsoring today's webinar. We will be emailing everyone a link to the recording. You may view that recording as frequently as you wish or share it with your peers. If you have any additional questions, please contact Disaster Recovery Journal. Thank you again, and this now ends today's webinar.